It's a pleasure to be able to talk in this venue. So today I'll mostly talk about, as Vivek mentioned, opportunities and challenges in designing human-centered technologies in collaborative setting. And just a little bit more that I wanted to tell you on my background is that I come from a computing background, and I actually have a PhD in human-centered design. So a lot of the approaches that I'll be speaking about today come from that lens. I work with health researchers, but I don't have a health research background myself. So take that lens that I come in with as you listen through the rest of the talk. I'll jump straight in. So many of you might have heard of human-centered design. I'll actually talk about it at length a little bit more in the talk. But design and human-centered computing are increasingly used in health research. This was not always the case, and it's really increased recently. Looking at the funding of health research from the US National Institute of Health, there's been an increase in the funded research that uses human-centered computing to over 500 health proposals that were funded with over $200 million over the past 10 years. And this includes starting to fund research centers and training programs that aim to bring together human-centered design and health researchers. So there's an increasing interest in that space. Looking at the publication space in articles in PubMed, you can also see an increase of high numbers in the publications that use user-centered design. And there are a lot of benefits for why we would use human-centered design in health technologies. Research shows they can prevent medical, when this process is used, it can help prevent medical errors and reduce patient harms, can reduce physician burnout when technologies are designed with a human-centered approach, encourages health innovation, improves engagement with underserved populations, improves algorithmic decisions. There are a lot of great outcomes that come from using human-centered design. But if you're not very familiar with this process, I want to give you a couple of examples that are very small, but in concrete ways show you in ways in which technologies can fall short of incorporating user needs. And so for that, I'll use some examples from physical activity technologies, apps that some of you might have on your phone or you've heard of, and how they might or might not incorporate people's needs. So here's an example of the Nike app interface. It provides people with a list of physical activities they could do. It's great, it makes it easier to find exercise routines and how to do them. But these are very generic activities. They're not actually aligned in any way with preferences of the user. In fact, in our studies, we find that when people have everyday injuries like back pain, wrist pain, or just a cold, they can't actually engage with generic lists of activities like that and need customized solutions. This is an example from MyFitnessPal, a very popular app as well. It provides people with plans that include time-based instructions from when to exercise. So for example, here they recommend that the person wakes up 10 minutes early to take a walk in order to exercise more. But again, it doesn't actually account for whether the user can fit this into their everyday life. They might have to prioritize sleep, might have a child to take care of, and this intervention might actually not be a good fit for them. Apps are actually increasingly trying to collect more information about users in order to provide recommendations that are useful to the users. But they create these onboarding experiences to support tailoring in their recommendations. But these are still very limited, these onboarding experiences. Often they're collect a user's age, their gender, how often they exercise, whether they want to lose or gain weight, And this can be great as a starting point for classifying a user, but again, does not account for the context in which people use technology. When we look at the types of goals apps support, often they're based on defaults. For example, setting a 10,000 step goal for someone who doesn't exercise much can get them discouraged and set them up for failure. Yet that's a default for getting onboarded into a lot of exercise technologies that use step counts. And if we take this example further, with the goals people set through technologies, if we look at their patterns over time, in an example like this throughout the week, we might see that a person might be meeting their goal every weekend, but never during the week. And so that suggests that goals maybe might need to be flexible or might account for different routines and activities people are experiencing throughout the week, throughout the month. Yet none of these routines, contexts that people are experiencing are incorporated in these tools. So there's still like a lot of space to incorporate people's routines and needs into such technologies. And I wanted to kind of start you off with some concrete features that illustrate ways in which people's needs might not be incorporated in technologies like exercise apps. And so how might we incorporate people's needs in technology? So that's where the human-centered design process comes in. I mentioned this in the beginning. If you're not familiar with it, I want to just speak a little bit about that. You might, if you search for human-centered design or user-centered design, you'll see a variety of models and steps that are involved in that. And an overly simplified way of thinking about that is that it's a process through which we assess users' needs that leads to specifying requirements for technology. Based on those requirements, we build prototypes that we test with users. We iterate through this process a bunch, and the hope is that that leads to a successful design. And I want to show you speak a little bit about what that actually looks like in practice to do some of these steps, because that will inform the rest of the talk when I'll actually point to people who are collaborating by using this methodology. So in human-centered design, an early stage is to understand the problem space and understand user needs. This is often done through qualitative methods, leads to unstructured research findings, might take shape in a way that involves a lot of post-its and affinity diagramming to draw insights. And an output of this stage might be, I want to give you an example from my own research, is, for example, thinking about technologies to support setting goals in mental health. The output might be a set of insights around the problem space of goal setting in mental health. For example, people have multiple evolving goals. They need to be simplified and adjusted over time, but they use a lot of reflection. So they're general insights about the problem space. Based on this stage, often because the problem space is very broad, we might narrow it down to some specific findings around how to support users and narrow down that large problem space. And that can take us to more concrete ways and through which we might design technology. So give you another example, also drawn from my work, is we were trying to design an exercise technology to support tailored recommendations for physical activities. We learned that using very rich user profiles are helpful in a peer support context. So surfacing people's routines, preferences, constraints, past behaviors, and that help us translate these insights into concrete potential user interface designs. So once we have concrete insights in this user-centered design process, we go through an ideation phase. that gets us closer to designing a technology. So this might involve ideas about what technology to design. It's often low fidelity. It involves things like storyboards that are hand-drawn, or low fidelity prototypes that are hand-drawn. So this is an example of from my colleagues around designing a tool using acceptance and commitment theory in a patient-provider interaction set. And these were artifacts used to get feedback from participants around what to build. And then over time, we iterate on those artifacts and develop mid and higher fidelity prototypes that are closer to the technology that we'll eventually build. And at all these stages, we incorporate user feedback to refine the prototype that we're building. So this is an example from technology to support tapering, or a tool to support like exercise planning. So the reason I wanted to give you these examples was that for the rest of the talk, what I want to speak about is how these technologies get created by teams, and the challenges in incorporating this human-centered design process when we work in a collaborative team that involves health and design researchers. And knowing a little bit about these methods is important going into that. So throughout the rest of the talk, I'll also be taking a team science lens, looking at how researchers collaborate. And I'll also be giving you a little bit of background of what I mean by that. Right, to understand how user-centric health technologies are creating, it's really important to look at the process that people use to do so. So in the research, we looked at how health and HCI researchers collaborate. And the team science lens that I use is really thinking about team science as a field that studies how teams work together to achieve their goals and objectives. And using kind of an ecosystem approach to team-based scholarly initiatives. So what I mean by that is that the success of a team is largely based on scholarly work that depends on circumstances and events in which that team operates. And that can happen at different levels of the ecosystem in which research is conducted, and how well aligned each of these parts of the ecosystem are. So for example, a science team that wants to create and apply new knowledge is dependent on the abilities of each of its team members to execute tasks, their interpersonal skills, their training. The productivity and even existence of a team is impacted by the support it receives from institutional leaders or from research funding agencies. So there are a lot of pieces that need to come into place for a team to exist and operate well. And one of the aspects that I will focus on is research team integration. So specifically the extent to which a science team combines its distinct expertise and work into a unified whole. And that's where I'll think about incorporating this human-centered perspective, expertise into the whole of a team. And I'll be taking this lens of the research kind of development life cycle in integrating perspectives at the team level. So what I'll be talking about is the challenges and opportunities that come up throughout the stage where a team is developing the research. Essentially, they're convening a group of potential collaborators to define the problem that they're going to work on. The stage where they conceptualize the research, so developing research questions, hypotheses, design of the research implementation, where it's executed and the execution of the planned research, and then the translation of the research, through which solutions are provided to translated to the real world in practice. And for the rest of the talk, I'll be speaking about some published and some unpublished work. And some of this work was done with Shefali Haldar and Charmaine Poblete. Shefali is now at Merck, and Charmaine was a master's student working with me about the challenges that early and mid-career researchers in human-computer interaction and in health encountering collaborating together. So this is based on an interview study of 17 human-computer interaction researchers and 16 health researchers who we interviewed about their experience of being part of collaborations of health and human-computer interaction that use human-centered design to create technologies. And most of these researchers were kind of early and mid-career at the stage of professional stage. We were really interested in the challenges that new researchers are encountering. The field is becoming increasingly collaborative. The researchers are increasingly doing their PhDs and completing training in environments that are much more collaborative than they might used to be, especially in involving human-centered design. And so we found that it's like a really important time to assess what is the state of the field in terms of the challenges that people encounter in working together right now, as the field is growing a lot in incorporating these methods of human-centered design into health research. And so kind of to start off, before I actually talk about a lot of challenges that people encounter, I want to highlight that our participants overwhelmingly saw a lot of value in both on the health side and on the kind of human-centered design side of the research to work together. And some of that is we can see through the words of the participants. User-centered design is so impactful. The idea of if you do it right early on, you will most likely save a ton more work and redesign later. If you don't do it the right steps up front, you're likely having to change a lot later, and that costs a lot of money. And participants also find it important to do this process. I've learned now just how important focusing on the user is, including involving them throughout the process. And so I won't spend a lot of time speaking about how useful participants found to have these collaborations, because I've hopefully told you a little bit about that early on that convinced you. But I want to start speaking about the actual challenges in researchers working together. And so the challenges start early on. So starting collaborations is difficult. What we learned is that people encounter, when they're seeking collaborators, they encounter a lot of challenges in even finding collaborators. So there's a high burden on the individual to seek collaborators, especially on the side of the computing researchers. They have to rely on essentially reaching out to people individually in their communities, reaching out to their mentors, peers, to help connect them to other collaborators. However, some of the things, so one of the things that has helped people is that in the research field at this institutional level, sometimes there were opportunities to actually more easily connect with others. So we, some of the participants we interviewed were part of postdocs that helped connect human-centered design and health researchers. That essentially set them up for having collaborators as they moved on in their at least early career that didn't require a lot of effort to start up, because they already had built those connections through their postdocs. People found it useful to go to institutionally organized meetups or presentations ran by research centers when those were available. People found it useful when sometimes funding agencies like foundations brought people together who are interested in a certain overarching topic, because that helped get people in the room who might be interested in collaborating with each other, and that actually sparked collaborations from some of our participants. However, at least on the human-computer interaction side, all participants actually experience a lot of challenges in finding collaborators. And some people spend actually years to find a collaborator, putting in extensive efforts, cold emailing people, having their chair, their dean introduce them to other people, having former mentors introduce them to potential research matches. But because of their location, their institution, it can, for some participants, it was actually pretty difficult to find those collaborators. And some of that, I also want to contextualize to the fact that some of the computing researchers we interviewed, although a lot of them were at R1 universities, some were at R2 universities, teaching colleges where they were still research active, but connecting to other researchers was more limited at their institutional level. So just forming a team was extremely difficult for our participants, right? We want to design these technologies, people are motivated to do it, but even finding collaborators is difficult. Now, sometimes people speak about almost a dating process with their potential collaborators. So when it came to human-computer interaction researchers, they were always looking for certain elements in their potential collaborators to decide whether they want to enter that collaboration in the first place. And so that involved aligning research agendas and values with their collaborators. And so what human-computer interaction researchers were looking for was understanding whether their collaborator would be differential to the patient's needs and views, or if they wanted to share decision-making and they had an orientation towards society, towards patients, towards other subject matter experts. And that's where we see this human-centered perspective being important in the health research. Now, if a team came together and formed, which was great, the next step might be to collaboratively conceptualize research. However, a lot of people encounter challenges at this stage of the process. So some of those challenges were at the team level, some were at kind of the impacted by funding agency levels. So at the team level, there were often misunderstandings of what was the role of the human-computer interaction researcher. So health researchers might see them as a practitioner, someone who will redesign our EHR, for example. Other researchers saw them as the programmer. You can program a thing that I envision in my head and you'll create it for us. Other health researchers saw the human-computer interaction researcher as a usability tester. We're going to develop this whole thing and then you're going to tell us if it's usable. And so the challenge with these perspectives is that they actually don't capture the scholarly involvement of the human-computer interaction researcher, nor does it involve those researchers early in the conceptualizing of the work. And so that means the HCI researchers come at a later stage in the process and often does something that's it's less scholarly and more practice oriented, which means that it comes in misalignment with that human-computer interaction researchers' goals of advancing scholarship as well. and just creates tensions and misunderstanding what their expertise is and what they can bring in. On the other hand, this one is actually about misunderstanding the clinician researcher's role. So HCI researchers also sometimes are not knowledgeable of the health researcher's role. So an HCI researcher mentioned that, this one's the right quote. They had a very narrow vision of what a health collaborator does. For example, this participant thought that they're just going to build that missing piece, just bring in the clinical domain knowledge. And so this participant talked about how, again, that collaborator brings in knowledge, but did not account necessarily for the goals of that collaborator and the scholarly impact that they want to make through the work, and just saw them as the missing expertise in their project. And these misunderstandings about the roles of the researchers were also impacted by expectations from funding agencies or the research field. So what one participant told us is that there's a big gap between what NSF funds and what NIH does. And somebody who works in the NIH space has, I think, has trouble looking at this and seeing what the HCI researcher does as valuable. For example, running the study with 40 participants, it's not an actual clinical trial to them. And does that evidence really mean something? And so this highlights the tensions of research contributions and what's valued between the computing and human-computer interaction field and the health field, and highlighting how a 40 participant study is perfectly acceptable, even fewer participants in the space of human-computer interaction, and the type of funding that comes through NSF that supports that work, but it's incompatible with some of the goals that someone who's actually funded through NIH and the type of scholarly work they do, and what their expectations are. And another tension that was reflected through actually the funding agencies was a participant mentioned that the HCI community associated with the NSF community values, and those are values of innovation. But this participant speaks how simple text messaging interventions, they work just fine. They've been shown to be very effective with many populations, but they're not innovative in the NSF space. So that's not something they could really publish as a Chi paper, which is like one of the top venues for this participant. And the tensions in this, the role of funding and the collaboration was even at the stage where researchers were writing together a research proposal. So one of the human-computer interaction researchers mentioned, I kept wanting to add more of my own research into that aim. But they were told, you don't need to do that. That's probably going to mess things up with the NIH grant. You really are just the app person for now, which of course made it challenging for them to feel like they're part of the collaboration, but they had to conform to these expectations of getting funding that actually impacts whether the work gets done. And funding also reflected in this imbalance of needs and resources that each of the researchers had, because health researchers needed some amount of funds to support their salaries and being able to do that work, while the HCI researchers needed funds to support their PhD students. And this tension of NIH grants being more likely to kind of buy engagement from the health researcher because it buys in their time that they might not otherwise have. Whereas NSF grants are not designed to secure time from the PI in the same way because it supports often PhD students. And so that made it difficult to conduct work that computing researchers wanted to do because and was funded through NSF because it did not actually secure their health researchers' involvement in the same way through funding. All right. Now, for teams that actually do manage to get past this stage, right, and they come up with research projects that they're successfully working together, the next stage that they need to are faced with is that they need to align their methods and their processes in order to continue working together successfully. So that, of course, also comes with challenges because and some of these challenges came in the level of understanding qualitative methods. So in incorporating human-centered design process into the collaboration, it involved a lot of qualitative work. Sometimes this was seen as anecdotes. The design methods sometimes were seen as being creative rather than a systematic process. And so these were challenges that needed to be overcome by the team. A challenge in using human-centered design was that there was a need to balance like user input with actual patient outcomes. And so there was a tension of giving people what they want versus creating things that are clinically impactful. Researchers operated on different timelines. And so they would mention that to do in-depth qualitative analysis that is necessary for human-centered design, it's going to take more time. And so trying to find that balance of how can we carve out both the resources and space for that qualitative research while still keeping funding projects on schedule was difficult. Researchers had different publication outcomes. Health researchers in particular mentioned that we just write differently. HCI folks, their journal articles feel like their dissertations each year. They're so long and so much work goes into it. Whereas in medical journals, papers can be 3,000 words or less, and in HCI, they're over 10,000 words. And that, again, created tensions in time allocated for these outcomes. And when it came to translating and implementing this research, one of the things that came up, especially on the human-computer interaction side, is that the researchers themselves discuss how they're ill-prepared to handle things like clinical trials because we don't really learn much about clinical trials as part of our PhDs in HCI. So that's where often their participation either stopped or was very limited. So what can help in addressing a lot of these challenges? In the words of participants, well, some of the things that were really important were from what participants told us is that it was really important to, throughout the process, be respectful of each other's disciplines. And this HCI researcher mentioned, how do we bring them, clinical researchers, in, but respect their time and not be burdensome? We don't want to be extractive with the little chunks of time they have. They don't really have the capacity. Some of the researchers didn't have the capacity to be full. We kind of spent hours a day on the research, especially when that funding was not involved. So people tried to actually be thoughtful about how to make these collaborations work and try to be understanding of each other's discipline. And that was a really important aspect. Researchers talked about artifacts, especially the HCI researchers, artifacts that can help incorporate human-centered design into the process. So things like showing the end results of the human-centered design process, showing how sketching is helpful and why, sharing examples of technology that they've built so that they align perspectives across the team members about what might get built. Using a lot of kind of past projects to show the value of human-centered design. And they brought this into the collaborations and found it useful. Researchers talked about translating terminology and spending a lot of time really explaining how the different terms, what they mean in each discipline. And they also mentioned the importance, the health researchers mentioned the importance of building design knowledge. So one participant mentioned that people in medicine and health, they would really benefit from a design course for developing health promotion or developing materials more effectively. We have very good theories on how to change behavior, but how to design and implement it's a much weaker area. And so all of these challenges that I mentioned at a high level, they're not actually new challenges. Research teams experience these challenges across different science disciplines all the time. The specifics, though, give us insight about how health and human-centered design researchers experience these common challenges themselves. And so here I had some examples of things that can be done to support researchers in working together more effectively. We can develop training programs that connect researchers to more easily form collaborations. That's where, for example, the Health Training Institute is an opportunity for that. There are symposiums that researchers started organizing, for example, at the major conferences in human-computer interaction, and AMIA, the Medical Informatics Conference. There are research centers like the University of Washington Alacrity Center or Northwestern's CBID Center that have funding to bring together researchers from human-centered design and health to work together, be trained, and develop collaborations and research that integrates both perspectives. There's an increasing number of human-centered design courses in public health and in other types of similar departments. Multiple actually human-centered design faculty mentioned interest in K awards that would support them in training in the health domain, but that is difficult to actually, there were not enough incentives for those participants to actually pursue those because they weren't aligned for the early career researchers with tenure expectations and how they would spend time pre-tenure to apply for those. The next point I wanted to touch on is the importance of supporting and rewarding translational work. And on this front, there are efforts in kind of methods in building tools to translating methods or building shared vocabularies. And so some researchers are actually working on kind of developing exemplars, for example, for how to publish qualitative research in medical informatics, or how to align implementation and user-centered design strategies to impact health services and through mapping terminology. And so some of this work is happening through publications that are aligning methodology and terminology. Of course, there's a lot of room to develop and use communication tools between team members, which researchers in team science have worked towards, but we have not heard participants using these tools much in their collaborations. Well, I didn't touch upon this as much in the talk, but there was participants talked a lot about recognizing their cross-disciplinary research in promotion and the different types of roles people might take in the project. So for example, the computing researchers might do the usability testing sometimes, which is not seen as a scholarly effort, but it's just part of the work, and recognizing the variety of that type of work that the researchers are doing was important. And here we can learn from there are toolkits out there or that people are developing for how to support promotion, or what to write in order to highlight the contributions people are making to projects in the process of promotion. And so to wrap up, some of the work that I'm doing next in my lab is looking at how we can translate some of the methods that human-centered design researchers are using to support these collaborative teams, for example, through developing personas or scenarios that make it easier to translate health needs into technology design. And we're further understanding how to support teams to incorporate user perspectives, particularly in AI and sensing technologies. And with that, I'm excited to take questions and thank the participants for actually a lot of time, generosity, and a lot of sharing of vulnerable experiences in their work.
Elena, thank you very much. I want to kind of open it up to the audience. I even see Kat from Switzerland. Questions. Let me lead off actually, and I'm curious because of mHealth, I've been in this space, and you are a graduate of the mHealth training institutes, and you came in, and I'm kind of curious about your own experiences beyond your research, walking into this transdisciplinary institute with people with very different frameworks and vocabularies, and then suddenly each team coming up with a composite solution to a health problem that they had identified. So tell us a little about how your research maps onto what you did as a scholar, your lived experience as a scholar.
So as a scholar, well, actually the Institute was part of, I had started thinking about this project, but planted more seeds in my mind about doing this work. I think as a scholar, some of the things that I noticed at the time were just how differently we went about identifying the problem that we were going to work on. And I haven't really documented. I wanted to document how exactly we did it, but what I remember a lot of was that we had a lot of health researchers on the team, of course, and I mean, they had their expertise that was either a specific domain, condition, population, and the problem space really derived a lot from that expertise and like populations they knew and the problems they had, which is fair. But in some ways, at some point, or like they were experts in a certain technique. Or like therapy, and that kind of impacted the problem space, whereas how we narrowed it down, whereas the human-centered design researcher, I mean, yes, we do now start with some constraints, but it's much more driven by the user's needs and what they say they need, and so like that was hard to actually align as we were moving forward. In kind of iterating to what is the problem we're trying to address. So I saw that as being one of the biggest challenges and where we spent the most time in. And I suspect people do spend a lot of time doing that alignment in practice as well. Or at least that's what we heard from participants.
Interesting.
I would love to ask you to say more, but then it would be an interview.
No, it is. It's interesting, and philosophically, when I look at my own university, R1, we don't really have even HCI on campus. Yep. So many universities don't even have HCI, which is a very small So most people don't understand. And yet, when I look at probably the company, the biggest company in the world, which fundamentally transformed and made their devices a part of our daily experience. When I think of Apple, it's all driven by HCI, and I mean, they've mastered it in a way that Google and Microsoft cannot. So obviously, it shows how important it is. But we universities struggle to come up with solutions, but often lack a HCI dimension to what we do. But I see we have Stephen and Kat and other prominent people. Any of you want to comment? Kat, you worked in this space. Are you around?
Yes, I'm sorry. By my accident, I activated my microphone. I am currently in Europe. Never mind. The fact is that I very much, as I said in my own webinar, I very much appreciate mHealth Institute, in which the message was whose turn is now, and I transferred to my students. So whose turn is now is I explained to my students that sometimes we may be treated as engineers, where a specific feature or a specific function is for us very easy to develop, and there is nothing to publish there. And then we take another turn and we improve the initial idea. And it's a turn taking. It takes a lot of time and it takes a lot of courage. And I also do a lot of homework. So I also read clinical papers, and I get into depth of webinars and depth of the disease area or prevention or whatever the case is, and do my homework and try to bridge the gap. And that's the way I lead. Thank you. But thank you for this extremely important message. Thank you.
Thank you for the comment. I think it would be wonderful to have kind of compile a set of recipes for success of what researchers are doing to be successful in these collaborations, because I think there are a lot of things that the community has mastered collectively that are not necessarily shared across.
That is correct. So maybe we should all write an opinion paper.
We actually have been using the mHealth Institute as a test bed to look at team science and looking at social network analysis. And the one interesting facet is the engineers, and they're always embedded in each of the teams. They tend to be slow out of the gate. They usually listen more than they speak initially. But towards the end of the institute, they are the most dominant nodes in their teams. So it's as we watch these nodes evolve and thicken, so to speak, the denseness of their conversations, the engineers towards the end tend to be the ones shaping much of the narrative of their teams at the mHealth Institute. So I'm kind of curious. I see. I thought I saw Stephen. Stephen, are you around? There you are. You're on mute, but Stephen, good to see you. That's another example of HCI gone wrong. I think you're still on mute, Stephen. No, for some reason, you may have to unmute yourself.
It doesn't get automatically muted right away.
Yeah.
I guess just to add to your note that the engineers were not talking as much at the beginning, part of my part of my experience in not speaking a lot at the beginning was that the health researchers just have the domain expertise in knowing, their domain and the patient perspective, what are the actual health problems that need to be solved. Whereas, as a non-expert, I wouldn't know that.
Stephen, you're back.
I figured out how to get it. I know, you know what it was? I have a headset. It's sitting off on the side. that's plugged into my computer that is not what is functioning anyway. It didn't let me unmute. So it's just, I want to say I appreciate the work that you're doing because I've lived it for a long time, and it's, I mean, everything that you said resonates with me for sure. It's both rewarding and very challenging, I think, to have these sorts of collaborations. And I guess that, you know, for me, fundamentally, the thing is, it's ultimately about relationships between the PIs, and they take a long time to establish. Because I've had collaborations that worked. They worked pretty well because we could manage the give and take and the types of things you talk about, the disconnects between the communities. And I've had some other ones that are more of a struggle. And I think for me, most of my medical collaborators are really more in the behavioral science space. And so that also makes things a little bit easier. When I've worked with people who are a little bit more in what I would say the medical space, less preventive health types of spaces, I find it even a little bit more challenging. It's harder to have a sort of a meeting of the minds in that case. But I mean, everything you say resonates with me. I don't know what the answers are. I'm fortunate to be at a university where this type of collaboration has been encouraged or tolerated. And I'm personally the type of person where I've just figured I would try to make it work. But I also know of people who've said, you know, this is just more complicated than my life needs to be, especially when it comes to things like the tenure process and stuff like that. And so that's, I think, pretty hard with the differences in the funding agencies and things like that. So yeah, I appreciate what you're doing. I wish it were easier. I don't know how to make it easier though.
True, very true. It's quite shocking to me at the 40,000 feet view to see great universities have exquisite silos. And as Elena points out, that the tenure and process committee, and I speak firsthand, I was on our university's tenure and promotion committee, you know, and the departments love intellectual purity. So if you're not doing, they don't like people going from computer science to HCI, which, you know, is a softer, touchy-feely type of science per the regular CS people. So much so that places like UCI, they have their own school of informatics and they take the HCI researchers away from computer science. So there are many things that are happening, but we lose as a university when we don't break through those and create these transdisciplinary spaces which are much richer. And we see that in our mHealth world. But yeah, it's a shame, and I'm hoping that part of Elena's work and your comments get disseminated a bit more. That these are serious computer scientists and researchers who are out there willing to engage. That is true.
I hesitated to use the word transdisciplinary because I am not sure that these teams actually achieved that. That feels like a very high bar that I'm not sure the teams actually achieved.
It's just the frameworks and the incentive structures are so different. And especially when you get into the clinical care arena, you know, you are more reactive and you are used to seeing immediate, versus an HCI is thoughtful and deliberate and many rounds of iteration, which you don't, you know. So they're coming from very different ways of training and reacting to that.